Hi, my name is Janet Mirabal, and my final presentation for the capstone course is about mental disorder. This work is for the Florida National University, and the instructor name is Jose A. Perez. According to the World Health Organization, some 450 million people around the world have mental disorder, which make it imperative to study in depth its causes and possible treatment. A mental disorder is like a heavy burden in many occasions, invisible to those around us. It does not matter how much we try to ignore the symptoms, because in the end, the safest way will be the one that guides us to find the necessary help. And that's why the reason that what I choose to talk about this topic is because there is a misconception among people that mental disorders are isolated cases and they are rare in our community. The reality is that in America, like in many other countries, mental disorder or mental conditions are one of the leading causes of human disability. Currently, there are more than 200 classified forms of mental illness, but two of the most common are bipolar disorder and the generalized anxiety disorder. The bipolar disorder is a severe mental illness that affects people of all ages around the world. This disorder is distinguished by the presence of episodes of mania and depression. Those changes in mood swings affect a person's behavior, judgment, energy, and especially the ability to reason. And at the present, there is not a specific cause for the onset of this disease, but research believes that one of the several components that contribute to the development of this disorder is the genetic background of the person. Studies have proved that children born to parents with bipolar disorder are 15 to 25% more likely to develop this disease. In addition, it is thought that children whose parents have bipolar disorder, on average, they experience the onset of the first symptoms 10 years before their parents. The chemical imbalance in the brain is another dominant factor because neurotransmitters are the chemicals responsible for sending messages to different areas of the brain. For that reason, when an imbalance occurs, the risk of the person to experience the onset of the symptoms increases exponentially. Also, the environmental factor plays an important role when the person has a genetic predisposition to the disease. When people are diagnosed with bipolar disorder, this condition is classified into 1 to 3 types depending on the severity of the symptom. For example, bipolar disorder 1 is the most severe of the 3. Individuals with bipolar disorder 1 experience very drastic change in their mood and ability to function, and as a result, many aspects of their life are affected. Another important fact in the bipolar disorder 1 is the episode of mania and depression, because this kind of episode may persist for long period of time before alternating or changing consistently, and this is known as rapid cycles. In the case of bipolar disorder 2, this type of the bipolar disorder is considered the less severe of this disorder. In this, the individuals experience generalized episodes of depression in addition to one or more episodes of hypomania. The hypomania is the mild form of mania, and the presence of these symptoms is what determines if the patient is having an episode of bipolar disorder 2 or an episode of depression. Also, cyclothymia is considered the mildest type of bipolar disorder. The patient suffering from cyclothymia, they tend to suffer more episodes of depression and hypomania, but in this case, the episodes are less severe than those of people with bipolar disorder 1 or 2. The treatment for bipolar disorder usually involves medication and some form of psychotherapy, and among the most used are mood stabilizers like lithium. This one is used to control episodes of mania and hypomania. Other medications used are antipsychotics, antidepressant antipsychotic, and benzodiazepines. In addition to medication, there is another approach to the treatment, and this is the psychotherapy, which is the key part of the treatment. In this case, the psychiatric care provider may recommend a cognitive behavioral therapy to identify negative behaviors and beliefs and then replace them with a positive one. Other types of therapy can also help in the management of this disorder. For example, the psychoeducation and the electroconvulsive therapy, to mention those two. Another disorder that is commonly seen is the generalized anxiety disorder. This disorder refers to a mental condition where the patient is unable to cope with different things in their life, like work, school, marriage, and other personal issues. Following this, there is a persistent worry about everything in their life, and this feeling could persist for about 6 months. Until now, experts have posited that the origin of this disease is unknown. But besides that, some reasons have been assigned to the GAD, and some of them include family background, biological complications, and life-changing experience that leads to stress. To an average person, the unwanted worry can seem unreal. But for persons with this type of disorder, the anxiety cycles are usually beyond their control. One of the most common symptoms of this disorder is the difficulty to concentrate in any task and the loss of sleep, as well as the easily agitated state of the person. Psychiatrists have mentioned the diarrhea and other complications of the digestive system as one of the symptoms that people with GAD are likely to experience if the treatment is not thought on time. Since GAD has been blamed for causing disability, the doctor has focused on ways to treat this disease and prevent its prevalence in our society. Freud Simon considered that therapy is one of the best treatments for cognitive ailments. For GAD, patients is commonly used the cognitive behavioral therapy because this targets unhealthy thought and help the individual to cope with anxiety. It also teaches the patient how to react in difficult situations. And for chronic cases, doctors usually prescribe an anti-anxiety drug as part of the treatment. In my opinion, mental health and physical health are very closely related. For a person suffering from a mental disorder, the fact of getting up every day and facing life is already a challenge. Many times, people with mental health problems say that the social stigma and discrimination they experience make their recovery more difficult, as they feel ashamed of their situation. This causes that the symptoms sometimes getting worse and the recovery of the individual is affected. People usually see individuals with mental illness as aggressive and dangerous, vicious, or weak. The population frequently tend to consider this behavior as deplorable due to the misunderstanding and disinformation of the society regarding this condition. Likewise, psychiatric hospitalization is more stigmatizing than outpatient treatment due to the belief that people with psychological problems are all aggressive and unpredictable. It is important to promote programs for integral development of individuals with mental disorder. It is fundamental to guide people so that they can have the necessary resources when looking for information about the mental health service offered by our community. In general, it is necessary to expand the prevention, care, and rehabilitation program for people with mental disorder. In this way, we will be promoting health. And as a conclusion, I could find that in addition to medication and other types of treatment, like psychotherapy, the successful control of any mental disorder depends on many other factors. It is necessary to have a healthy lifestyle, get enough sleep, and a healthy diet, and be physically active to avoid or postpone future episodes. Because people with bipolar disorder are also at higher risk of suicide, it is important to encourage them to seek immediately help. The attitude of the family is also important when it comes to help a person with a mental disorder. The task is not easy, but no matter what it will cost, it is important to persist and offer help even when this help is rejected. Thanks for watching this presentation, and now I leave you with a video that I found interesting and also will help you to understand that anyone can suffer from a mental disorder. One more time.
Mental illness can affect anyone. Mental illness can affect anyone, giving them a dark side. Just because we cannot see it does not mean it's not happening. Mental illness can affect anyone, giving them a dark side. Just because we cannot see it does not mean it's not happening. The truth is, anyone can suffer from mental health issues, regardless of age, gender, nationality, financial status, or position in society. In fact, statistics show that people from developed countries are more at risk, and sharing this knowledge with them can help them and set them on a road to recovery. With the bad stuff happening around the world nowadays, this slideshow is more relevant than ever. According to the World Health Organization, mental illnesses account for more disability in developed countries than any other group of illness, including cancer and heart disease. According to the Centers for Disease Control and Prevention, approximately 1/4 of adults in the United States have a mental illness, and nearly half will suffer at least once from some mental illness during their lifetime. The most common mental illnesses in adults are anxiety and mood disorders. These cause pain to the people he or she is associated with. The effects of mental illness range from minor disruptions in daily functioning to incapacitating personal, social, and occupational impairments, and even premature death. Mental illnesses cost the United States alone an estimated $300 billion annually. Mental illnesses are found to also have a direct impact on an increase in psychosomatic illnesses, leading to multiple chronic diseases, including cardiovascular disease, diabetes, obesity, asthma, epilepsy, and cancer. Through spiritual research, we have found that 80% of the population in developed countries suffer from some type of mental illness or psychosomatic illness during the course of their lives. With such a large percentage of people experiencing mental issues, the stigma usually associated with it is unwarranted, and one should not hesitate to reach out and ask for help. Behind the superficial veil of psychological disorders, the real cause behind such mental illnesses are usually spiritual factors, which mainly arise from karma or destiny that a person is born with, departed ancestors, and negative energies from the afterlife who take advantage of people, especially those who have more personality defects and ego, such as anger, pride, emotionalism, greed, and envy. Personality defects are like mental wounds, and negative energies are like spiritual germs who prey upon such mental wounds, controlling people for their own benefit.